how can we help people maintain good mental health in the face of COVID-19?
Yeah, so how mental health in COVID-19 is extremely important. So we all acknowledge that this is a stressful time, and there will be worry and fear for your own health, for the health of your family, of your community, for the finances of your household. These are normal things to be going through, and it's completely understandable. There are certain people in your communities or your households that we are more vulnerable to stress, and those include, for example, the vulnerable groups such as older people that we've talked about, children and teens, people who are unemployed or have substance misuse issues, and people who have pre-existing mental health issues. So I think it's important that we look out for those people especially. There are other things you might find just to look out for in terms of monitoring yourself for stress, so things like difficulty changing your eating or sleeping patterns, difficulty concentrating, and trying really to monitor if you do use alcohol or tobacco. Often in times of stress, the use of those increases. So it's advisable to try and not use those things as a crutch really during those times. If you're isolated, it's understandable to feel bored, to feel frustrated, to feel angry. These are all normal things. If you can communicate with people, virtually if you can, but otherwise perhaps just by phone, it's important to let these things out, to talk to each other, to communicate, so that we know we're not alone and we're all facing the same thing. I think the things that you can do to support yourself are, while I think it's great to be up to date with the guidance and keep up to date with all the changing COVID scenario, it's important to give yourself a break, because looking at these scenarios hour to hour, day to day, actually sometimes creates more stress. So sometimes make sure you have a window of time where you switch off any social media, where you don't look at newspapers. I think that's important. Take care of your body. So some people do breathing exercises, some people do meditation. If you can exercise, which is fine, it's outdoors if you can, but I understand in some settlements that might not be possible because of security or other issues. But where you can take exercise, take leisure if you can, especially outdoor activities. But I think the key point for me is communicating. Tell people how you feel. A bit of advice for parents: if you're a parent, your children's stress and anxiety levels will mirror your stress and anxiety levels. So if you can be a role model for your children and try and I suppose maintain calm, that will help your children in many ways. It will be up to an individual family how they choose to either to inform their children about what's happening in terms of COVID-19. If you do choose to do that, which I do think is a good idea, obviously tell the children in their own in language which they understand, but I think this helps to arm them with the facts themselves. And I think as a community, the spreading of knowledge, it really is an empowerment, and it is able to support us to really understand what's going on, and I suppose to drive down some of the fear and anxiety levels. Because, to reiterate, I've said it a few times, the vast majority of people will return to full health from this illness. Some of you will be parts of civil society organisations, women's cooperatives, community groups. You could consider whether you want to adapt those groups temporarily whilst we have this pandemic towards COVID-19. I think that we have a lot of power, intellect and energy within our communities to be able to support each other through this. And so if you are a member of those groups, perhaps meet with your peers and think about how you could support your community in terms of knowledge sharing, for example. So those are the things that I'd suggest. We are all in this together, and whatever country you live in, whatever community you live in, and I think we need to take collective responsibility and lead by example.
Thank you so much, Dr. Tom Wingfield. We really appreciate you taking time from your extremely busy schedule at the front line of COVID-19 in the UK to share advice, words of wisdom and experience and solidarity with us in the Arise Hub and in other projects too. So huge thanks to you.
Thank you.
Go well.
Thanks everyone.
Thank you.